Hello and welcome to Dr. KT DPT. I'm Dr. KT, a holistic and integrated physical therapist, and I'm so excited that you're here. Today I'm going to show you a very simple mobility routine you can do when you have low back pain, hip pain, stiffness in your back or hips, and for natural stress reduction and grounding. This routine can be done right on the floor or in your bed, so wherever you wish to be. Make sure you have your emotional support dude, always good to have by. Chocolate really wants to be here. All right, so let's get started. Before we get started though, I ask that you take a moment and you hit subscribe to my channel so that you can get updated notifications on new videos, as well as like this video so that you can keep getting more. All right, so to get started, you're gonna find yourself on your back. You can lay anywhere really. And what you're gonna do is you're just gonna bring one knee to your chest, keeping your other foot on the ground. You're just gonna bring your knee towards your chest and hold it for about 2 to 3 seconds and relax. You want to make sure that you're drifting your knee in a straight line from your hip towards your shoulder and not necessarily outward towards the side. You're going to do 5 of these, and then we'll switch sides. And then you switch sides, bring the knee towards the chest in a nice straight line, hold for 2 to 3 seconds, and release. And you'll do this 4 more times. And you want to make sure you're feeling a nice stretch either in the front of the hip or the back of the hip, no pinching. If you're getting pinching sensation, you can drift the knee out a little bit, it will help. However, if you keep in that nice neutral alignment, it will help stretch the hip rotators, which are usually one of a big contributor to why people have low back pain, hip stiffness, and back stiffness. Wonderful. Now you're going to go back to your original knee, and you're going to place your hands on it like it's just a cap, like you're capping on your kneecap. And you're going to create circles with your arms and your hip in one direction and then the other. You can stay in continuous direction if you want, or you can switch. You're doing 5 each way. And you're just trying to move in a comfortable, pain-free range, no pinching, and just kind of getting things opened and moving. And so I don't have an exact system when I do this stuff. I just kind of feel how my body's feeling. If it wants 2 around in one direction, I'll do 2. If it wants 1 every other, that's all I'll do. Switch sides, cap that kneecap, and all you're doing is just creating circles with your hip using your arms and kind of churning it like you're churning butter or churning some sort of like thick soup. And you're trying to create nice motion in the hip by going both directions. So like I said, you'll do 5 each way. And just go at your own pace, smooth and easy and comfortable. And it is a great thing to do to help wake up your body in the morning. Wonderful. Coming back to the start position, you're going to come behind your knee this time. And as you're going to extend the leg up just slightly, keeping your toe bent away. And so you're going to keep your toes pointed down or away, and you're just going to come up till you feel a gentle stretch behind your leg and then back down. You're going to do that 5 times. In a nice, comfortable, smooth motion, pain-free. You should not feel an extreme stretch here. It should be very light to nothing. If you have any numbness or tingling in your legs at the current time, I suggest and advise that you go sub, so you're not feeling any sensation in the back of the leg. It will help decrease irritation on the nerve. After you hit 5, you're going to keep your leg extended at that position, and then you're going to bend and straighten your foot. And so you're going to do this again 5. You can even do it 10 times if you would like. So I like 5 because it's just easy to remember. And then you relax, come down, and switch sides. Repeating that same motion on the other leg, toe is pointed away, and you're extending the leg just slightly so that you feel a gentle stretch to nothing behind your hamstring or the back of your thigh. And you're going up and down nice and comfortably 5 times. Once you hit number 5, keep the leg extended and you're going to bend and straighten that ankle. Again, you can do this 5 to 10 times depending on what you feel. Just kind of go with the flow based on how your body is reacting and responding to the motion. Wonderful. Coming back to neutral. This time you're going to heel toe your feet so that they're wider than hip distance apart. So you should have a large spread between your legs, and you should have your feet wider than your knees and your hips. Now you're going to drop your hips, keeping your hands on your hip bones, these pointy bones here in the front of your hip, you're gonna keep your hands resting there. You're gonna drop your legs to one side and then the other. The reason why your hand is on your hips is to prevent excessive pelvic and lumbar movement in the beginning. So you're doing 5 each direction. As you can see, I'm moving in very small ranges. This is just hip rotation. So right now I'm teaching the body, my body, and you're teaching your body how to dissociate pelvic and lumbar motion from the hip. And so it's important that these things move all together, but it's also important that they're able to dissociate and move individually and separately. And so once you hit 5 in each direction, you can relax your hands, you can rest them to the side, and now you're gonna go all the way, so you're getting your lumbar spine and a little bit of your thoracic spine involved. You can bring your hands out to the side, kind of like a little T or a star, and you're just dropping your knees to the other side. If any of this causes pain in any part of your body, just stay submaximal to that. And what I mean is don't go so far into the range, and just stay to the ranges and the places where you experience no pain, and maybe just a gentle stretch. And you're going each direction 5 times. This next one after here is going to take advance on this. You're going to roll to your side. You're going to have something to support your head if you wish. Now there's going to be 2 ways you can do this. You can modify it or do it the original way. It's called the pretzel. Your one leg is coming in front, the top leg. The back leg is going behind. You want a nice straight line between your torso to your thigh, all the way to your knee. And you're reaching back and grabbing that back leg, and you're gonna use your other arm and you're gonna hold this leg down as you look up and out. Now, if this is something you can't do because of flexibility, here's how you're gonna modify it. You can use a strap, a dog leash, a belt. Wrap it around your foot and you hold it. If that is too intense for you, what I advise that you do is take something like a blanket or a block and put it under your thigh on the top side, kind of support yourself up, and just do a side lying quad stretch. And so you're not necessarily opening up doing the trunk rotation, but you're kind of doing more of that quad stretch to get that opening up in the front of your hip, which is often an area that causes people a lot of issues when they have pain and stiffness. So we'll switch sides, hold that for about 15 to 30 seconds or a minute, depending on how you want to do it. You can hold it up to 2. And the goal here is just to allow the body to relax, allow the body to stretch, and allow the body to ease its way into a different position other than sitting in a chair or being crouched up. And so after you hold it for as long as you wish, release that position, and you're going to roll to your belly. Go away, blanket. And when you're on your belly, what you're going to do is you're going to use your hands and make a pillow. So your hands are going to be a pillow for your head, and your head is just going to rest gently. Your forehead is going to rest gently on there. You're going to take your right leg or your left leg, which one do you ever want to start with, and you're going to bring it up to the side, kind of in that similar position as you were just in, except this time you're going to be in what's called half frog. In this position, you can stay here and maintain this position, just breathing into your back body, and you're trying to expand into this area of your hip and buttock. Or if you feel like you can tolerate an advanced version of this stretch, you can prop up to do a half frog with a sphinx. You want to make sure that you're driving your hip bones towards the ground, you're keeping them in contact with the earth, and you're not propping too far up, because this is going to be a beautiful exercise to help open up the lumbar spine, the hip joint, and all those little areas in between. Wonderful. You'll hold this again about 30 seconds to a minute, whichever way you choose to do it. When you get out of that position and rest, I like to use this position in the morning before I wake up to kind of get my body ready to get out of bed. And then you switch sides. Half frog, again, leg is up out to the side, 90 degrees in the hip, 90 degrees in the knee, and you're just resting here. If you're unable to get that far up, you can always modify and just go lower down. It's okay. Use what your body has and can give you. I have a lot of flexibility and mobility because this is something that I work on regularly. And so you too can gain access to this motion in your hip by practicing regularly motions that do that motion. So if you need more hip flexion, you want to train your hip flexion at end of range in hip flexion. It will help improve the strength of the tissues as well as the range over time. And if you want to try the extended version, you just prop up, whatever's comfortable to you. After you've done this for about 30 seconds to a minute, you'll find yourself back into the start position, and then you press up into a tabletop. From this tabletop position, we will be doing what's called a segmental cat-cow. With the segmental cat-cow, you're moving one vertebra at a time. This is not easy, especially if you've never done it. It's also called a spinal wave in other practices, but it is one of the most important things you can do for your body and nervous system. So I like to start at the pelvis, especially when people are starting this new. I want you to imagine there's a laser pointer sticking out your butt, and it's taped to the back of your, kind of sticking out your tailbone, taped to the back of your sacrum. And what you're doing is you're allowing it to point backwards, and you're going to move that laser pointer. So most of your motion is going to come from here. It's going to initiate from this region, and then you're going to try to move vertebra by vertebra by vertebra all the way up the spine. And so I will show you how that looks, and you'll do this about 5 to 10 times. So it's really slow. As you can see, I'm not doing it with my breath, but my breath I'm trying to keep as easy and steady throughout the whole thing so that my body is able to go through the segmental rotation or motion to complete. So you start in neutral, okay? And we're gonna go into extension. So you're gonna point that laser pointer up. So as you point that laser pointer up, you're going to imagine one segment is moving at a time, and then as one gets to its max, you're moving to the next. Then you're out of the lumbar to the thoracic spine, moving more into thoracic to the cervical spine, and then you're back at that full extended position. Now you're going to reverse the laser pointer and you point it down. This is difficult because when you point it down, you want to follow that whole motion right away. I want you to hold that flexion in the upper part, extension in the upper part of your body as the lower part of your body goes into extension, or the lower part of your spine. So you're segmenting by pulling that tailbone under, moving vertebra by vertebra. You might have to squeeze your glutes to help with the motion. But as you get to that mid-spine, you start to kind of press into the ground, and then your gaze is last. And then you just reverse the motion. Do this about 5 to 10 times. It's not easy, and it takes time. Mine's not perfect. Don't strive for perfection. Strive for daily improvement. Wonderful. That's about 5. To finish the sequence, you're going to find yourself into a nice child's pose. And in this position, you're going to work on maximal posterior expansion. And what I mean by that is you're going to work on maximally breathing through your diaphragm into your lower mid back. And so you're focusing on expanding that mid part of your back where the ribs meet their bottom so that you're using the full capacity of your lungs. And just breathe into this for about 5 to 10 times, inhaling and exhaling out through the nose. If you can make your exhale longer. Sorry, we have puppies and something happened. And if you make your exhale longer than your inhale, you will find yourself in a more relaxed state. You can uncurl the toes, widen the knees, however to do this position and posture to be comfortable. You can stay there and rest, or you can find yourself in a seated position, but that mobility routine is completed for today. I hope you enjoyed this video. Please make sure that you subscribe to the Dr. KT DPT channel. I would be forever grateful for your support. Also, like this video so that I know that you're enjoying it and I can share more. Please share this with anyone you think that may need it, and as well as use the link here below to join my email list so that you can get weekly notifications on all things related to holistic, natural health, physical therapy, and spirituality. So I hope you have a wonderful day.